Hi guys, today I'll be talking about dermoscopy. What is dermoscopy? So dermoscopy is used for diagnosing different dermatological conditions such as inflammatory dermatoses, cutaneous infections, scalp diseases, and nail abnormalities. It assists with distinguishing between two or more conditions using submicroscopic observation of skin lesions. Key features to identify when using a dermatoscope include the morphology or arrangement of vascular structures, scaling patterns, colours, follicular irregularities, and particular features or clues. Consideration needs to be given regarding the individual's family history, the location, number, morphology, and distribution of the lesion to ensure that dermoscopic findings are accurate for different skin conditions. Although most skin conditions have certain dermoscopic patterns, others display non-specific features. For this reason, proper and accurate clinical information needs to be considered to assist with diagnosis. The use of suitable equipment is required to effectively examine dermatoses. Non-contact polarized light dermoscopy is commonly selected over conventional contact non-polarized light dermoscopy, as the pressure from the latter may blanch the vessels and/or scaling when using a liquid immersion. However, conventional contact non-polarized light dermatoscopes are better for looking at superficial lesions and structures, including comedone-like structures. So now I'll just talk a little bit about some different skin conditions and lesions and their dermoscopic features. So I'll start off with benign melanocytic nevi. So these are usually symmetrical and have a homogeneous structure. They are either flat, raised centrally, or completely elevated. So common dermoscopic features can include a cobblestone pattern, which is a common pattern of congenital nevi, aggregated dots or globules, this is common in childhood nevi, a pigmented network or reticular pattern, which occurs in adolescents and adults, often from UV exposure, and a homogeneous structureless area of pigmentation. So benign melanocytic nevi can be either compound, dermal, or junctional. And this is just a quick clip that I've recorded, and this is just how you would use a dermatoscope and to look at different skin lesions and just some features. So some of the patterns you can see, so you can see a reticular pattern of pigmentation and a homogeneous structureless area in this nevi. Plaque psoriasis, so some dermoscopic features of plaque psoriasis include evenly distributed white scales and symmetrical dotted vessels on a light red background. Another specific vascular pattern is red globular rings, which are organized in irregular circles or rings, but this is not very common in psoriatic lesions. Rosacea. The main dermoscopic features of rosacea include linear vessels organized in a polygonal network. Other identifying features are follicular plugs, rosettes, scales that are white or yellow in color, pigmented structures, orange to yellowish globules, follicular pustules, and dilated follicles. Dermatitis. The dermoscopic features of dermatitis depends on the stage of the disease. Acute dermatitis presents with randomly arranged dotted vessels and yellow scales, whereas chronic dermatitis includes uniform dotted vessels and a white halo. Seborrheic dermatitis. So the main dermoscopic features are a patchy arrangement of dotted vessels and thin yellowish or white scales. Other less common features include yellow or orange areas, follicular plugs, linear branching vessels, and a structureless white area. Lichen planus. So some of the dermoscopic features include fine white or grey lines or dots, otherwise known as Wickham striae, on the top of a red background. Other dermoscopic features include red globules and/or linear vessels, usually around the outside of the lesion, pigmented brown globules or dots and/or reticular patterns, and white or yellow dots. Seborrheic keratoses. So dermoscopic features include comedo-like openings, many milia-like cysts, fingerprint structures, hairpin blood vessels, moth-eaten borders, and a well-demarcated border. Solar lentigo. So solar lentigo can include fingerprint structures, moth-eaten borders, homogeneous pigmentation, uniform reticular patterns, and pseudofollicular openings. So these are the main dermoscopic features of solar lentigo. Haemangiomas are benign vascular lesions. They are purple-red macules which are made up of dilated subepidermal blood vessels. The key dermoscopic features of haemangiomas are homogeneous red or purple lacunes. Sebaceous hyperplasia. Characterizing dermoscopic features of sebaceous hyperplasia include crown vessels, comedo-like openings, and yellow sebaceous gland aggregates. Actinic keratoses. So the main dermoscopic features include erythema, scales, and keratin plugs. Squamous cell carcinoma. So the dermoscopic features of squamous cell carcinoma include a nodule with a central yellow keratin plug, centrally located arborizing vessels, and hairpin vessels around the outside of the lesion. And finally, basal cell carcinomas. So these can be nodular, pigmented, vascular, superficial, and the main dermoscopic features include several blue-grey dots and globules, spoke wheel pigmentation, blue to grey ovidness, erythema, arborizing vessels, erosions and ulcerations, superficial basal cell carcinoma. Key dermoscopic features include erythema, fine short telangiectasia, arborizing vessels and some erosions, whereas nodular BCCs present with arborizing telangiectasia, blue to grey brown dots, as well as blue to grey ovidness. Thank you for listening.